So I'm going to be talking about a project that was supported by Vancouver Island Health Authority as a collaborative health research project across the Island Health region. So for those that aren't from here, this is largely Vancouver Island and the Gulf Islands that surround that. So the real West Coast. In terms of territorial acknowledgement, want to acknowledge the territories that we're on here, but also to acknowledge the territories around the island that this project was conducted on, Coachella lands, but specifically Nachalnith and Kawak people, where we did this research. So I'm going to provide a bit of an overview on the project, and then talk a little bit about our initial results, and then, if we've got time, a little bit around implications. This is kind of theoretically based within this concept of minority stress, and this lovely slide actually comes from our moderator, Sarah Chown. So the idea here of really thinking about the impact for people who are living in different environments that may move either within the region, join two larger urban centers, and then the implications of doing so in terms of changing social networks, greater access to resources, or better affirming care. And functionally how that then shapes people's wellness that can elevate health inequities. So, in terms of this project, it's a part of our broader community-based health equity research program at UVic. We have a diverse team of academic and community-based researchers, and we do this as interdisciplinary work within a social justice framework, and really have an orientation to try and improve health equity. So in terms of our project, the impact objectives were really to support LGBTQ2 plus individuals on the island, to think about ways in which we could reduce disparities in mental health, substance use, as well as ST, sexually transmitted and bloodborne infections, and to think about ways in which we could advocate for more responsive and effective prevention services, as well as healthcare services for the population, and increase access to HIV and STI services for guys and to guys. This is a photo from one of our project teams in one of our downtown offices. And in terms of our team members, these are kind of them divided by organizational affiliation to some extent. So a number of people from UVic, Kate, Emneet, and Layla are some students that have worked with us. Ken Josephson and John Fowler from the Department of Geography, Kathy Worthington, Eric Roth, Robert Campbell, Antonio Morantes, and Bernie Paye, who supported particularly the qualitative part of the project. From Island Health, Dee Hoyano, who's the ID lead, infectious disease lead, and Paul Hasselbeck, both of whom are medical health officers. Sophie Benner-Martin, who's the STOP HIV/AIDS lead, Lawrence Campo and Elizabeth Colangelo, who have been analysts with the STOP program at Island Health. And then folks from AIDS Vancouver Island and Vancouver Island people with AIDS Society. So Jonathan Degenhart, Craig Dales, and TJ Furlani, who are here, I think, sitting in the corner, as well as Chad Dickey, who people might have met yesterday, Nathan Grills, and Marshall Kilduff as well. So in terms of our methods, we really focus on two kinds of main activities. One were qualitative interviews with folks across Vancouver Island, and the other was doing what is called community mapping in the Island Health region. So how many people have heard of community mapping before? Okay, a few, quite a few actually, good. It's nice that our project team people have heard of it, that's good. So we went to 7 different Pride festivals or gatherings within the region. And we've got some photos here to just kind of show what it looks like. This is our booth at Victoria Pride. So we had these just a 10 by 10 tent set up with these colorful banners, and then we had these kind of maps that were hung up. So behind Ken here on the left was a big map of the region. And this was an example of the booth at the Comox Pride. And so this was really trying to show up in the Pride space and see whether people would engage in mapping. This hadn't been done before with these particular communities on the island, and so we were kind of curious as like, does this work? Will people want to spend time at Pride doing this? And so in terms of this, the idea really here was to be a form of engagement and to find new ways of which we can collect data that really highlight experience that aren't necessarily just doing surveys, which I talked a lot about today. And so to do that, we gave people the opportunity to use different colored dots to indicate where they came from, and I'll show you a little bit more about that. We also developed different icons for different kinds of services or resources in the community that people could put onto physical maps to show where they went to access STI testing, for example. And there are also these kind of story cards that people could fill out if they had longer experiences they wanted to share. and that's kind of just a little bit more on that process. So here's an example of Vancouver Island, kind of tilted a little bit to be more vertical, and you can see that there's different colored dots where people indicated where they came from. So this was from the Campbell River Pride Festival, and we had a little bit of a legend on the right-hand side there. You can see where we just put different colors next to different identities within the spectrum of our community, and folks could pick as many as they want and put them onto the map. This was a super fun piece because people were always curious about the kind of outliers and where different people were coming from. Also, their ability to find themselves and where they come from on a map was also a good conversation point for some people. And then this is kind of more of how the icons worked. So these were kind of basically Google Map vinyl sheets that we printed off for the different cities that we went through, or towns, and people could put onto these maps individual icons for different kinds of resources. And then we had these 2 large chart papers that asked these 2 questions. What are the greatest barriers to healthcare and HIV STI testing? And what are your priorities for action to improve LGBTQ health? And then folks could simply write answers onto that, and then they could use the dots again to kind of vote in dot matrices, if you've heard of that before, to indicate their support for different points that people raised. For us, what we found is that the color, the activities, doing all of those things worked really well in terms of engaging folks, and as long as the weather was good at Pride, which no one can control, it tends to go fairly well. So what we then did was take all of that data and synthesize it into a map, and this is what Layla helped us with, a geography student. And so what this then can create fundamentally is an interactive Google map where you've dropped all of these resources that people have identified as being LGBTQ friendly. One of the other things that we also asked people to identify were negative places or negative experiences they had, so people could indicate that on the map. We then took this to our community advisory group and talked with them a little bit about this. The main findings I would say from that are twofold, one of which is it wasn't a comprehensive capture of all of the different services or resources that are available. And that in terms of our next steps around this, we would say for the places that were identified positively, we were going to reach out and say, hey, FYI, pat on the back. Some folks identified your service, your business as being something positive for the community. For those places that were identified negatively, to do some gentle reach out to say, hey, you are also identified. Is there supports that we can provide you? Here are some opportunities for capacity building. And so really thinking about this more as an engagement process with those institutions or organizations, as opposed to necessarily trying to say that we've created the comprehensive queer resource for the island. I think my clicker is dead. Is there another way to, oh. Take a moment, and why don't we all stand up if you're able, and offer to give a high five to the person next to you, because you've all made it to the end of the day. Go ahead, take a moment. I'm not going to do anything. I know. Actually, ironically, don't teach much in person anymore. Should I bring this to them, do you think? This doesn't even have a battery pack. I mean, do you want to explain it? I will. It's working on the French, but not the English. Oh. I think it's working if you can reline them back up. Yeah. Okay, I'm going to push it. Okay, these are some of the information that we got back from people in terms of the story cards. So people were sharing more detailed experiences of some of the resources that they identified. So in terms of businesses, someone said, this was a safe space for all humans. We have a no judgment policy regarding questions and preferences. In terms of talking about a clinic, someone said free HPV vaccines for trans, non-binary, fluid folks, MSM questioning in women under 26. So the kind of a little bit more richness to the actual icons that were placed onto the map. We also had negative experiences, so someone talking about one particular clinic saying, June, my girlfriend was dead named at, and we've just redacted the clinic name, or concerns about confidentiality. So one person saying, no one discussed confidentiality, and there was nothing about this in writing. So it was kind of interesting process of being able to collect maps, but also then these kind of brief qualitative snapshots of people's experiences. And then we kind of had those big chart paper questions that I talked about, and so this is kind of a summary of those. And so in terms of the greatest barriers to healthcare or testing, people talked about fear, discrimination, stigma. I think really resonates with the quantitative data that Aidan just showed us. Assumptions of heterosexuality, lack of access in terms of spaces, clinics, hours, or physicians, and a lack of education amongst healthcare providers. In terms of priorities for action, there was a strong call for more practitioners, particularly more female physicians, more nurse practitioners, more LGBTQ physicians and nurses, improved education, so earlier in school, I'm thinking about more inclusive sex education and healthy sexualities, education for practitioners, particularly around transition issues, and on non-binary identities and experiences more broadly, calling for more inclusive and safer spaces, whether that be gender-neutral washrooms or all our welcome signs, and better and improved access. So a need for more facilities outside of the major cities, access to hormones, access to counseling and mental health. So in summary, this kind of just pulls together all of those pieces that I just talked about. And in the interest of time, I'm just going to move on. So we also did some interviews, and these interviews were conducted over the spring and fall of 2018. There were 21 in total, 15 from Victoria and 6 from outside of Victoria, from different parts of Vancouver Island or on the Gulf Islands. We had a pretty good age range, and the sample was predominantly white, but about half were living with HIV, and we had a pretty good mixture of sexual orientation and gender identities. This kind of shows the overlap of those, and functionally, while about half of the interviews were with cis gay men, the other half of the interviews were with other kinds of intersecting identities, whether they were trans gay men or cis bi guys, or during other combinations of such. In terms of our coding scheme, we used some early interview transcripts to then develop what we saw as kind of some of the key issues that were arising across the interviews. And so we're in this process now of needing to apply those coding schemes. The team, of course, is waiting on me because I'm the one who holds things up. But what we identified basically were community, so talking about relationships, talking about migration, about social spaces, issues around identity, so people's own social locations and complexities around that, processes of coming out, and intersectionality, issues around stigma, whether that be related to PrEP use, HIV stigma, or other STIs, but also people's resiliency in the face of adversity. Specific conversations around services, particularly barriers, access, and safety. Issues around mental health and wellness. And then also the use of technology. And that's something that came up from the range of thinking about social media and community connectedness online, cruising apps, pornography, and also shifts that occurred over generations in terms of technology. These are kind of some preliminary high-level high-level results from the interviews. Generally, during positive experiences seem to outnumber negative ones, which I think was kind of interesting when we often have quite a negative narrative of experiences for queer folks outside of urban centers. During people talking about resiliency, about being very savvy vetters of healthcare providers that they would engage with. During access in terms of issues from the urban-rural divide. The Vancouver Island region is a great place to think about research because we have a big city like Victoria, and then we also have extremely rural and remote areas of the island as well. And a lot of conversation about mental health services and counseling. Community and connection was also a major theme, and people talking about kind of access or segregation or spaces within the community, and how inclusive they were for different members of the community, as well as communities in transition. And this really related to issues of generation, and as well as kind of changing natures of gayness, queerness, and community. There was also quite a bit of overlap in between the mapping results and these interview results. But there was one major difference that seemed to come up. And so the participants in the interviews that were living with HIV discussed the complexity of navigating through the healthcare system to access the services they needed. They also talked about being referred through several organizations before being able to access medications or other services. However, they noted that once they were connected with healthcare services, those services were generally quite good. And so we definitely heard a lot more from POS folks in the interview, and that was a bit more explicit. This is a quote that I'll just give a bit of context to and leave it up there for folks to read while I go through. So Kate wanted to share this quote because while participants described their health services as being mostly good, they referenced wanting to access something more from their community, or they referenced the kind of transition or fragmentation within the LGBTQ2 community, or specifically the gay community, but they didn't have a lot of language to describe necessarily these feelings, and so this one participant is kind of an example of that. And so to highlight part of their quote, this person said, "I would love to see less about place-based and more about organizations that can transcend different spaces. They also talked about a need for mentorship or connection to create more spaces for themselves. So I think for us, I mean, there's a lot of implications. I think one of the pieces that really came clearly is around education, both within our communities, but also in terms of working with providers and services. When we think about some of the opportunities that exist for advancement, there's the professional development course that was developed through UBC for doctors that specifically focuses on gay, bi, and other men who have sex with men. So I think there's a lot of work to be done necessarily in terms of serving broadly the LGBTQ2 community. And there has been some work, particularly around aging in the island context. And if folks haven't met Robert Savage, he's a new postdoc working with us that's going to be looking specifically at this community's relationship to palliative care and hospice care. And then I think the only other thing that I just wanted to kind of highlight is that we have this kind of interesting opportunity broadly in the country through this new report that was published through HESA. And so I think if folks haven't read this report, please do. I think it really is an important policy and advocacy tool for us. There's a number of recommendations in there, from sexual orientation and gender identity change issues to the blood ban, that are things that we've all been talking about. And I think to be able to hold that up as a federal document to say, during this was a report that was issued, I think is a really useful tool no matter where we are in the country, and really making it a priority for everyone to address what needs are being articulated by our community. So I think I'll leave it there. And just want to thank our funders.